Hello and welcome to this very quick video, probably about 10 minutes long. I'm just going to go through about pulse taking. Now, the inspiration for this video came when I was recently talking to a black cabbie. Family friends gives a lift up to London for my mum's birthday, and talking to him, he was talking about cold water therapy and how he's getting into that and how he's been kind of reading the books and other bits and pieces. And one of the things he said on there was he's been quoted that by doing this cold water therapy, that he will be able to reduce his pulse rate, so his heartbeat, by 20 to 30 beats per minute. I'm not going to kind of get into the cold water therapy side or anything like this, but what I kind of said to him was, well, what is your pulse now, or what was it when you first started that? And he actually didn't know, and what he said was, oh, I haven't got one of those smart watches, so I don't know. And I was like, well, can't you take it manually? And he said, oh, I don't know how to. So this is for Darren, and this is just a quick video on how he can take his own radio pulse, and then he can kind of know what his pulse is, and then he can check it at another time. So the first thing is about pulses. First of all, you want to be really relaxed when you're taking your own pulse. So don't do it straight after kind of exercise or eating or having a drink of coffee or anything like that. So be sat down or even laid down and kind of be really chilled. I would suggest you want to be sat down for about 20 minutes, maybe 30 minutes, so you're really nice and relaxed. No kind of big distractions around you, and this way you'll get a nice accurate pulse measurement. You can do your pulse at any time of the day. It doesn't really matter. It will kind of fluctuate very slightly. So if you just come back from a run, you'd expect your pulse to be a lot faster. But what we're trying to get here is our resting heart rate. And I interchange the words heart rate and pulse because we are talking about the same things on this occasion. So I would suggest you don't want anything constrictive around your arms. So maybe taking your jumper off, but again, you don't want to be too hot, you don't want to be too cold. So you just want to be relaxed in a nice environment where you are. And what I'm going to do is go through taking the pulse in my wrist. So if I just turn sideways on here, this pulse that comes across here is your radial pulse, because in our forearm here, we've got two bones, the ulnar at the bottom, the radial bone at the top, and we've got a blood vessel, an artery. So arteries are always the blood vessels which take oxygen away from the heart. So the blood that is pumped out of the left ventricle, which is going to all of our cells, supplying them with the nutrients, the glucose and the oxygen they need. They're the arteries, and it crosses the radial bone around about here. So I'm right-handed, so I'm going to use my two fingers, and particularly the pads of my two fingers on my right hand, so my index finger and my middle finger. That's what I'll be using to take the pulse. I always avoid my thumb, so we don't want to use that for taking the pulse at all. So just the pads of my finger. And on my left hand here, if I hold my thumb upright, you can see where we've got this crease. If we get 3 fingertips, and literally the tips of our fingers run down the thumb until that third finger just comes off the thumb, with my index finger and my middle finger right on the top of the bone here, if I then roll them down, I don't need that third finger, they will be right over the top of my radial pulse there. If I have a little feel of my bone, I can feel there's a little nodgy bit on my radial bone here, and I just want to be up from that kind of bit there, and you can feel a little dip. If I tense my arm, you can see the tendons and ligaments which kind of activate all my fingers. I want to be up from them. That's why it's always on the thumb side, and it's in this little groove here. So there's a technique. Come down, roll down in that little groove, but you don't want to push too hard. If you push really hard in there, you can stop your pulse. You just squash the blood vessels, stop any blood going through. If I'm too light, I might not feel it. So it's just feeling that happy pressure where you've got a nice bit and you can actually feel your beat of your heart. And that's where I would suggest is the best place to do it. You can take the pulses in your neck, your carotid pulse. You've got a blood vessel which kind of comes up from your heart. It runs either side of your windpipe, your trachea, and it goes up, and that obviously then feeds your brain. So you can feel that. You can feel it on both sides or one side at a time. It's entirely up to you. With your pulse in your wrist, your radial pulse, which I'm suggesting we take, it wants to be roughly at heart level when we're taking it, so we can get it nice and accurate. If you raise your arm in the air, it will actually change the sensation, and it doesn't always do what people think. So some people think if you raise your arm in the air, the blood drains away, so it would actually get weaker. That's not the case. Actually, your pulse should get stronger because our bodies are fantastic at compensating. So as I put my arm in the air, it's harder for the heart to have to pump blood to keep them tissues oxygenated up there. So my heart works harder because it's compensating, so my pulse will actually get stronger. And actually, if I feel it as I'm lifting it up, I feel that change, and I can feel the stabilization of how it gets that stronger kind of beat. And then the opposite would work if I dangled it right down low. Actually, it would get weaker when it's down. And sometimes when I'm holding my arm down, I can't feel my pulse in my wrist at all. It goes. So that is very different to your capillaries, and if you were testing them. So they would do the opposite. So to do a capillary check, you pinch your nail for 5 seconds, let it go. It should return white within 2. But if my arm is in the air, that would turn back to red in a much longer time. So I'd have a delayed capillary refill, if I get the words out. And if it was down, it returns a lot quicker. So much faster capillary refill down there. But it's the pulse we're worried about here. So when I'm taking the pulse, I just really get into the pulse. Now, when I talk about this medically and we talk about taking a pulse on a patient, I will quite often advise you do it over maybe 15 seconds, maybe 30 seconds and multiply it. But if I'm doing my own pulse, I will do it over a whole minute. So what I want to do is get myself a clock, something with nice big numbers on that's nice and easy for me to see. And really, I'm going to avoid looking at the seconds. I don't want to be looking at the seconds because I know my pulse is very similar to seconds, around about 60 beats a minute. And I don't want to get the two confused. So what I would do is I'll be just looking at my clock and I'll get into my pulse and I'm really into it. And I may even be feeling my pulse for a minute or two before I look at the clock. And what I do is I'll wait for it to change that minute. And as soon as it changes to the next minute, I then start counting. And I just keep on counting until the minute changes again. And when the minute changes again, however many I counted during that minute was how many beats my heart is beating per minute. So I can get a nice accurate figure on that. People often ask of how many should it be? Well, it all depends on which book you read. So there are some books who suggest that between 60 and 100 is the average. And there's others that say between 51 and 90. I would go more with that one myself. I think between 51 and 90 is a more accurate figure for what your pulse really should be. So that's what I'd be looking at. My pulse was 56 for many years. It's just kind of gone up slightly as I'm getting a little bit older, which kind of happens. But with kind of exercise or maybe cold water therapy, I could reduce that back down again, and I'd be quite happy with a pulse around 56. I know many sports people, very fit people, their heart rate is even lower than that. I would be worried if it starts getting into the 40s, and if it, ever went below that, you'd have to be an extreme athlete for that to be normal for you. So I wouldn't want it that low, but kind of around the 60 mark is about right. And again, if you're doing this at the beginning before you start any kind of exercise or cold water therapies, then it wouldn't surprise me if you had an average resting heart rate of 70, 80, maybe 90, but that's what you're looking at reducing. So by using these different therapies, by using these different theories that people have got out there, you're looking at reducing that heart rate down. And so I think Darren was quoted that he could reduce his by 20 to 30 beats per minute. It may have been percentage, I'm not going to worry about those, but that's what we're kind of looking for. Around that 60 mark would be an average, would be good. But I say, it's all about doing it consistently. You could do this every single day, take your pulse, write it down. At the beginning, what I would do is probably do it 3 times. So I would do it when I was nice and relaxed, sat down for about 20 minutes, half an hour, and just chilled. And I would take my pulse, write down what it was, and then maybe another 10-15 minutes later, do it again, and then do it a third time. And I would have a nice average of what it is, and I can see what it is there. If I was laying down, so I lay down in bed, quite often I use my carotid pulse, and I just sit there and I feel the pulse. And sometimes I actually find that feeling your own pulse can be very therapeutic. Just feeling it, getting into the beat of your pulse, and even falling asleep feeling your own pulse. So there we go. There was that little video about radial pulses and how to do it on yourself. I will be doing another video about blood pressure because that's a totally different subject, but I will do one on that. So this video was just for Darren, the black cabbie, just so it can help him with his cold water therapy, so he can now accurately measure his radial pulse, and then he can do it in a few weeks, months time, and see whether he's made an improvement to his health and he's reduced his heartbeat.